Good morning, everyone. I am Dr. Meenu Ahuja. I am a consultant with Birla Fertility IVF. Let us now go on to the treatment modalities that we have to offer to our patients. The treatment not only involves the various assisted reproductive techniques, but also the emotional and psychological support that we should give to our patients. The patients who form the subset of infertile patients are extremely troubled, so be empathetic and we deliver the right kind of emotional support to them. Thereafter, let us also first in detail get their history in terms of their lifestyle. It is important to counsel them on their eating habits, important to counsel them about their exercise, important to counsel them to abstain from any substance abuse, any smoking, any drinking. Henceforward, then, after taking a detailed history, if they've had any previous treatment, we must go through the previous treatment records very carefully. The previous treatment records give us a great insight into how we can plan our treatment further and how and what changes can be made to help them achieve a pregnancy better this time. The treatment modalities that we have are IUI, IVF, IVF-ICSI. So let me just explain to you what these are. Now, if a patient comes to us first, we would first like to offer them the simplest possible treatment in case there is not much complication, which is called ovulation induction and follicular monitoring. Now, ovulation induction means that we are giving our patients some medication, some tablets, and rarely sometimes some injections. And then we follow them on the ultrasound, trying to see if their follicles are growing. And once the follicles they reach a size of about 18 to 20 millimeters, we give an injection called a trigger injection and ask the couple to have timed intercourse. So this is a very basic of how we start our fertility treatment. In case a couple is not helped by this methodology of ovulation induction and follicular monitoring, we move on to the next step of an IUI. Now, what is IUI? IUI is a method wherein again we are giving the female partner some tablets and injections so that she forms about 2 to 3 eggs, and once the 18 to 20 millimeter size is reached, we give a trigger injection, and about 36 to 40 hours later we ask the couple to come to our clinic or to our centers, and the male partner then has to give a semen sample which is washed and prepared, and using a very thin, soft plastic catheter called an IUI catheter, we instill this prepared semen sample of the husband into the woman's uterus. And this is an OPD procedure. We do not use any form of anesthesia. After the procedure, the wife has to, or the patient has to just lie down for about 10 to 15 minutes time, and we on discharge prescribe the medicines for about 2 weeks. After 2 weeks, we ask the couple to do a pregnancy test which will give us the result of the IUI. So this is a very simple procedure. It does not incur a lot of cost, and it is given to couples where the problem, let's say, is very mild. Either a very mild male factor, or the female has some ovulatory dysfunction, or mild endometriosis, but she should at least have one open tube. If she's got both tubes blocked, then she definitely is not a candidate for IUI. Now let me explain to you what IVF is all about. IVF, in vitro fertilization. Now this procedure entails us giving injections to the female partner for about 10 to 12 days, and in the entire process of these 10 to 12 days, we are also monitoring her the ultrasound and looking at how many follicles she is growing and at what rate they are growing. Once the cohort of the follicles, about 60 to 70% of the cohort reaches the size of about 18 to 20 millimeters, we administer a trigger injection. And after the injection, after about 34 to 6 hours, we plan a procedure called the ovum pickup. But this procedure of ovum pickup is done under a short general anesthesia. And the patient comes to us on an empty stomach the day that we plan this, and all the due consent is taken. She's shifted to the OT, and we carry out the procedure. Let me explain the procedure to you. It entails us using an ultrasound probe intravaginally, and via this route itself, a needle is introduced into each of the follicles, and under ultrasonic vision, we aspirate each follicle. Aspirated follicular fluid is then scanned by our embryologist, and the oocytes are picked up. And thereafter, we ask the husband to give a sample of his semen, which is processed. And inside our lab, the process of IVF is carried out, in vitro fertilization. After oocyte retrieval is done in our lab, we carry out the process of IVF. Herein, in our dish, we have about 75,000 sperms and one oocyte. We leave it for about 18 hours and then we document fertilization. Now, the process of documenting fertilization is to ensure that there are two clone hair present. Thereafter, we allow the embryo to grow further in the lab, and this is called embryo culture. So, we allow it to grow up till day 3 or day 5. A day 5 embryo is called a blastocyst. Now, when fertilization happens normally in our bodies, this stage after fertilization, the fertilized ovum takes about 5 to 6 days to reach the uterine cavity. And within this 5 to 6 days of travel back to the uterine cavity, the blastocyst stage is reached. So, this blastocyst is actually the stage which gives us higher pregnancy rates. And this comprises of actually about 50 to 200 cells. And there is an outer part or an outer leg called the trophoectoderm, which forms the placenta, the future fetus, and the inner cell mass from which the baby grows. Now, ICSI is another topic that I would like to cover. This is a specialized form of IVF, wherein we carry out micro injection, wherein using micro manipulators, one sperm is directly injected into the oocyte. This is useful in certain couples wherein there is severe male factor infertility, and also sometimes wherein we have had cases of total fertilization failure, wherein ICSI is extremely helpful. Now let me tell you what cases we need donor sperms and donor oocytes. Sometimes the female will have a low ovarian reserve. This can be premature ovarian failure, or this can be decreased ovarian reserve. Cases like endometriosis also, we may have to offer her the cases of donor oocytes. And sometimes when she has had a previous surgery wherein we have to remove the ovary. In males also, we will have to offer them sometimes donor sperms. Now, donor sperms will be given for males where there is azoospermia, cases where these sperms have a problem with the morphology, the number, the motility. Both females and males, when they are carriers of certain hereditary diseases, we may have to offer them donor sperms or donor oocytes. The donor oocytes and sperms will have to be procured from the ART banks, and the basic rules, regulations followed as have been laid down by the ART regulation 2021. Surrogacy means that a woman has a problem with her uterus, so she cannot carry a pregnancy in her uterus. And a woman who offers her uterus to bear the child of a couple is called a surrogate. What is allowed in our country is altruistic surrogacy, wherein there is no commercial exchange of money possible for a woman becoming a surrogate for a couple. According to the Surrogacy Act 2021, only altruistic surrogacy is allowed, wherein the a couple will probably use their own gametes, or it can be donor gametes, but never will the surrogate ever be a donor for the oocytes. She will only be donating her womb to carry the pregnancy till the time that the child is delivered, and thereafter she will relinquish any legal rights on the child. The child is a biological child of the commissioning couple and is genetically or may not be genetically linked to them, depending upon whether their own gametes were used or donor gametes. But what it has to be very clear is that the surrogate can never be a donor oocyte as well. Endometrial receptivity assay. This is a method wherein we biopsy the endometrium and the specimen of the biopsy is sent for molecular analysis. This tells us whether the endometrium is receptive for the embryo. It is offered in cases where there is recurrent implantation failure or repeated IVF failures. This helps us to map the window of receptivity for such couples and help us giving them better pregnancy rates. Assisted hatching. Now let us talk about assisted hatching. This technique can be done either mechanically or chemically or using laser. This helps us in cases where there have been previous IVF failures, where the woman is elderly, where there is a high FSH, or women there who have had previous implantation failures. Now what this technique does is that, especially when we talk of laser assisted hatching, under the microscope, the day 3 embryo, we are looking at the day 3 embryo and the laser is targeted wherein a small little hole is created in the zona pellucida. This helps the embryo to hatch out and implant better. This technique has shown to improve implantation rates. Let's then now go on to ERA. ERA is endometrial receptivity assay. In this technique again, we are trying to help out couples who have had previous implantation failures or IVF failures. Here, we are going to take a biopsy of the endometrium, and the biopsied endometrium is sent for a molecular analysis. And we study whether the endometrium is receptive enough for the pregnancy to happen. So the window of implantation or the window of receptivity is assessed, and thereby we either declare the endometrium to be receptive or non-receptive. This is also shown to help people have a better pregnancy rate. Now let's talk of fertility preservation methods. Under this, we talk of sperm freezing, we talk of oocyte freezing, we talk of embryo cryopreservation, and we can also talk of ovarian cortical tissue cryopreservation. Now let's first speak of sperm freezing. Sperm freezing can be offered to certain couples where the male is probably going to undergo some kind of a chemotherapy or a radiotherapy. So prior to that, he can freeze his sperms, freeze his semen. Sometimes the male partner is not going to be around for the fertility treatment, so we can probably give him a sample and this can be cryopreserved. Sometimes we anticipate that the male partner wants to undergo a vasectomy and they may want to plan a baby later. So in such cases also you can cryopreserve the semen. Now let's talk of oocyte cryopreservation. For some women who probably are busy with their careers, they don't want to plan a marriage yet, they don't want to plan a baby yet, or maybe that they have some kind of a cancer wherein they are going to undergo the procedure of a chemotherapy or a radiotherapy, so their ovary is likely to get damaged. Or probably they suffer from a condition like endometriosis, where the ovarian reserve is already low. So such women can be offered cryopreservation of their oocytes. Now in this procedure, you will give them gonadotropins or injections for around 10 to 12 days. And after having given that, they are simultaneously followed on the ultrasound where the follicular monitoring is done. And after the cohort is 60 to 70% of the oocytes are mature, that is size of 18 to 20 millimeters, we give give them an injection called a trigger injection, and then their eggs are retrieved. So the ovum pickup is done, and the pickup of the oocytes thus taken are cryopreserved. Now, cryopreservation of the embryo is also possible. So a couple who opts for cryopreservation of the embryos can always have an implantation done at a later date when they want to plan a family. So they can then undergo an embryo transfer. After this, I would like to tell you about ovarian tissue cortical freezing. Now, some girls, when they have not even achieved puberty, they can be afflicted by certain cancers. Now, such girls will have to be offered ovarian cortical tissue preservation, wherein the cortex of the ovary is removed and there is slow freezing is done, and we kind of preserve the ovarian cortical tissue. Once she is gotten over her treatment for the cancer, chemotherapy is done, the radiotherapy is done, and probably she is now in her reproductive years and she wants to plan a family, we can always do a transplant of this cryopreserved ovarian tissue back into her body. So this method enables girls who are unfortunate to have had a malignancy in their prepubescent life, and this has resulted in live pregnancies. So this technology is definitely a step ahead and has come from being experimental to being very much valid treatment modality in cases of prepubescent cancers in girls. So this is all that I had to tell you about the basics of the causes of infertility and the various modalities that we have to offer for our patients and the work that we are doing at Birla Fertility IVF. I hope this helps you. Thank you so much.
Journey towards parenthood with Birla Fertility and IVF.